for educational purposes only. Just wanna a quick reminder, this is all done under strict sterile technique. Okay, this is called the introducer, or we call a sheath or introducer sheath. This is a short plastic insertion tube into the blood vessel, and it's usually through the femoral artery or into the radial artery or the wrist, and this is done during cardiac catheterization. The main purpose is to provide a stable and controlled pathway for catheter to be introduced and manipulated within the blood vessel, and also putting in either a diagnostic or a guiding catheter into the heart, wires, balloons, and stents. So I just want to show you how to prepare this one. Again, this is going to be under strict sterile technique. This is, again, the sheath. You got the side port, and then you also have the dilator and the short wire, and you also have the puncture needle, the access needle. So what happened is that usually the proper way to flush it or to prepare it is flush it initially onto the side port, as you can see here, and then after that you're gonna have to flush the entire sheet, and as soon as you flush it you have to close it this way so that there's no seepage of the flush solution or the heparinized saline, and there's no escape of the flush, and there's no introduction of air into the sheet. So again, I'm gonna show it again to you guys. Flush this one, it's the side port. Open this one, flush the entire sheet, and as soon as it's flushed, you have to close it. And then this one needs also to be flushed. This is the dilator, and this needs to go in here, push it in, and you can hear a click. That means it's properly prepared. So this is how you'll be able to kind of see it. Again, close here. You can see here. The main purpose of this side port is to be able to give medication during the procedure, or to flush the sheet so it doesn't form any clots into the sheet itself. And that's the purpose of that. Okay. Now we're gonna go into what we call a manifold. So the manifold is a three-way system. Initially, this is called the contrast port. You're gonna have a tubing right here connected into a dye spike or into a contrast, and then you will have a saline flush, or what we call a heparinized saline, and then this is the last one will be the transducer, where you'll be able to put in the A line, or we call it a pressure transducer. So in able to use this one, first of all, I'm gonna get you how it is on the pressure line. So this connection right here, as you can see, this is all this is the patient side, and this is the transducer side. So always this is going to be the position that you will have to do in order to measure the pressure during the procedure. And then when you need to get some contrast, you have to open this one right here, as you can see, aspirate, and then if you want to inject, you have to make sure that you are tilted this way, so in order that the bubbles, so the air bubbles will go up, so you don't inject air into the system. You inject air into the system, especially in the coronaries, you're actually creating an MI because the blood displaces the bubbles displaces the blood that creates an MI into the coronary artery. Patient's going to get a lot of chest pain, and it will mimic a heart attack. So in order to inject, tap it, make sure everything is towards going up, and then inject, and then put back on pressure. And then if you want to go get some plush, open this way, aspirate it, and then now you can flush the catheter. So when you're flushing, aspirate a little bit, make sure there's going to be a blood coming up, there's no bubbles, and then inject the flush. Again, this is pressure. This is how you take out any contrast, and this is how you take some flush. All right, so contrast will be this way, right? Flush will be this way, and then pressure is going to be on this way. All right, again, this is all done in a sterile fashion, aseptic technique. That way we don't introduce any organisms or any kind of bacteria into the system. So again, when you inject, everything is up, and then top it so there's no air, anything is going to go up, inject, put back on pressure. So guys, thank you. If you have any question, please put on the comment below. Thank you.